We know that dementia can affect a person's ability to do some of the things we take for granted in our day-to-day lives. I could use some help in understanding how dementia affects those daily activities. To learn more, I'm meeting with occupational therapist Sylvia Koreen, who works with people who have dementia and their care partners. Sylvia, can you tell us, what does an occupational therapist do?
Well, an occupational therapist does many things, but in this setting, working with clients with dementia, we really are focused on maintaining wellness through activity, through task simplification to have a person engaged in purposeful activity. And also we do work with care partners as coaches. So we will help care partners, we will coach them to be able to do those types of analysis and engage their partners with activity as well.
Why is it so important for someone with dementia to continue to manage their basic day-to-day activities?
Well, activity really defines all of us, who we are. And we gain so much of our insights about ourselves through what we do, through our daily activities. It's really speaks to our ability to be independent. It speaks to our ability to for our own wellness, to be connected, to communicate with other people, and really it is how we define our quality of life.
So if we're able to help someone maintain those basic day-to-day activities longer, will that help their overall quality of life?
Absolutely. It improves their quality of life. It can often help slow down the effects of the dementia. It also keeps away depression, and it helps not only the client stay connected, but also their care partners, people that are involved in their life. It keeps their relationship more valuable throughout their lifespan.
So how is it that dementia can make it impossible on some days for someone to do something they've done 1,000 times before, like making a cup of tea?
That's a very good question. We look at those types of activities as very simple, but really when we're doing any kind of simple activity, it involves our procedural memory, and there are many, many steps involved. And a person with dementia will start to lose some of those steps along the way, and that's when they're all of a sudden not able to do that, what really is more of a complex activity. So it really is helpful for a care partner to be able to analyze that task and break it down into very simple steps so that the person can continue doing it. And so the steps might be bringing out the cup and bringing out the kettle and putting water in the kettle, and then taking the kettle, putting it on the stove, and then turning on the stove and having the kettle boil, and then turning off the stove. So all of those steps along the way. And if those steps are broken down and the individual can be cued to do it step at a time, that really does help them maintain that sense of control and that sense of independence. They can still do it.
Oh, absolutely. That's great advice. So what should we be thinking about when we're supporting someone in their day-to-day activities? Where should I start?
Well, in order to support somebody, you really want to focus on their strengths. We all have our own personhood. So we have our stories, we have things that we were good at, and our own personalities, and those things are maintained even though the person has dementia. So you can really focus on those things because a person really needs to feel that sense of control. A really good example might be a person might stop to not be able to put on their clothes anymore because, again, that's that procedural memory. So instead of just giving up and dressing them, it really helps to think about maybe laying out a couple of options for them, or maybe laying out an outfit for them in order so that they can put it on. Again, they're maintaining that sense of dignity and that sense of independence, and giving them a little bit of choice as well.
That's a great example of breaking things down step by step. Now, let's talk about other specific activities. What about bathing?
Okay, well, bathing, that is a very good point that you bring up, because often when a person has dementia, that can be one of the things that disappears from their daily life, is that desire or want to bathe. Sometimes it's even a fear of water. And it's a real struggle for care partners to be able to get them to, continue doing that. And I had a lady that told me a story once that had how it worked for her. This was her husband that had dementia, but she also remembered that he was very much a person, from his past who didn't want to waste anything. And so what she did was, one day she drew a bath with nice warm water and got towels ready and got the room all ready for someone to have a bath. And then she casually walked him by the bathroom and said to him, "Oh, look, there's this beautiful bath and no one to bathe." And sure enough, he took his clothes off and hopped into the bathtub because he didn't want it to go to waste. So that was a really good example of a care partner using that individual's strengths and remembering who he was to encourage him to do something. No muss, no fuss, and everybody was happy.
That's a great story, absolutely. So we've talked about dressing and bathing. How about other routines?
Well, any kind of routines, really, we all pattern our lives around routine. And that is actually how we manage to get through our days without missing some of those important activities or moments. A really good example would be that, for example, myself, it's not my normal routine to come here and talk with you. And so, of course, then there's a lot of change going on in my environment and I have to make sure I'm on time, etc. For a person with dementia, changing those routines can really throw off their ability to stay independent. So you do, as a care partner, want to maintain routines, keeping things at the same, getting up at the same time in the morning, having meals at the same time, encouraging a person to, do things in order. So brushing their teeth, going to the bathroom, having a meal, doing a certain activity, and keeping things calm and keeping things, in a kind of normal pattern will really help that person stay connected to their environment.
That's great advice. Is there anything else we should think about in day-to-day living?
Well, beyond keeping the environment really calm and regular, it really helps often to use visual cues. And so, for example, a person may forget where the bathroom is. And something as simple as actually putting a picture of the toilet on the door where the bathroom is can help them to remember how to get there, and it gives them that sense of independence and staying connected. And the whole reason that you want a person wants to stay connected and to stay independent is that it helps to stave depression, and it actually helps to maintain the memory longer.
Oh, really? Okay. And what about a person's leisure time and hobbies? Is that important as well?
Absolutely. Leisure and hobbies are, again, all activities that we do to stay connected, and it speaks to our quality of life. And again, that reflects back on a person's strengths. A person that may have, let's say, for example, a person was a carpenter, in their earlier days, and so they really enjoy doing carpentry. Now, carpentry can involve a lot of very dangerous tools, but again, breaking down those steps or looking at some of the steps that are not as dangerous can be very fulfilling. For example, that you might want to have a place where that person can be encouraged to sand down some nice furniture. So working on sanding, things that aren't dangerous, but still keep them engaged in something that they really enjoy.
Sylvia, you have a lot of great ideas. What is your approach in coming up with ideas to adapt to changing abilities?
Certainly, it involves a problem-solving approach, and as a care partner, you really do want to have an opportunity to look at what's changing, what's going different, and looking at an activity from the beginning, breaking it down into steps, looking at different options or solutions that maybe aren't what you normally do but are going to work, and kind of taking a more relaxed attitude about it, and letting that person do things in the way that they are able to do it. So looking at different options, trying them out. If it doesn't work, try something else, and you'll find something that will work for that person at the level that they're at.
Thank you. That's great advice. Before we wrap up, do you have any other advice for success for care partners?
For care partners, the most important things to do are to keep it simple, keep it dignified and respectful, and take it one day at a time. Maintain your sense of humor and never forget how important you are in this process. You want to take care of yourself first. Don't be afraid to ask for help, for support from family and friends, and you can always call the Alzheimer's Society in your area. They have wonderful staff that are very understanding and have great answers to your questions, and they can also connect you with an occupational therapist.
Thank you so much, Sylvia.
You're welcome.